Salmonella Dublin is a type of bacteria that are host adapted to cattle. It was named Dublin because it was first discovered in Ireland. It's an emerging disease in Canadian dairy herds and poses a risk to both animal and human health. Salmonella Dublin will first affect the calves when it enters a herd, especially those who are still on milk or have just been weaned and put into group housing. This disease has a sudden onset. Cattle can become lethargic, stop eating, have a high fever, heavy breathing, and have possible diarrhea. It can be very sneaky once it's established in a herd, though. Calves will just stop eating but can continue to act normally. This bacterium is ingested orally and moves from the intestine into the blood and lymph circulation, where it can then damage the lungs. Calves will experience hypoxic breathing, harder and faster.
What the producer will see is an animal that's breathing very hard. So when I tell producers, it's like if we took you and we stuck you at 25,000 feet, you'd be puffing away too.
When it first enters the herd, many calves may die as a result of the bacteria, but as herd immunity develops, mortality will decrease. Producers should be concerned about Salmonella Dublin and be on the lookout for the common signs and symptoms in calves.
According to data from the CDC and other places, that's the Center for Disease Control, Salmonella Dublin is the most dangerous salmonella in humans. It has the highest probability to cause hospitalization, it has the highest probability to cause bacteremia in the patient's blood, and it has the highest probability to cause death. What's really interesting about it, like that sounds scary, but what's really interesting, it's rare to ever see Salmonella Dublin infection in farm families. The major risk factor for getting salmonella is people eating food that has not been properly cooked.
Upon a postmortem examination of an affected carcass, you will be able to see interstitial pneumonia, large lungs, a swollen liver, and the spleen will be 4 to 5 times the normal size. This is due to the bacteria leaving the intestine and traveling through the blood and lymph to these organs. It's important to work with a veterinary diagnostic lab that has experience with Salmonella Dublin and works with a lot of cattle. A good question to ask is what percentage of your work is dairy cattle?
If they do a high proportion of their work as dairy cattle, 50% or more, you can have extreme confidence they're probably doing a good job.
When sending it in for a test, tissue samples work the best. Only some labs can get the bacteria to grow from fecal samples. The USDA has looked into how prevalent Salmonella Dublin is in dairy herds and has found that it is more common in large herds. This bacterium can be found most commonly in dairy beef or in custom heifer herds, since the animals come from multiple sources, transported lots, are subject to mixing stresses, and more. In Wisconsin, there is an estimated 20 to 30 herds a week in the summer and 2 to 5 herds a week in the winter that test positive for Salmonella Dublin. If Salmonella is found in young calves, there is a 25 to 40% chance that it is Salmonella Dublin. Salmonella is more prevalent in the summertime because heat stress has a serious effect on livestock. The animal's gut becomes more permeable during heat stress, so it's easier for the Salmonella to leave the gut and move into the blood. In herds where Salmonella Dublin is endemic, it can get missed. The bacteria can still exist in the herd, and the animals can shed it periodically. Although no more deaths may occur because the animals will have built up herd immunity, this bacteria can still affect them and pose a risk to human health. Since vaccines and antibiotics are not very effective against Salmonella Dublin, producers should focus on preventable actions instead. Be aware that there can be carrier animals. If calves get sick from Salmonella Dublin, up to 1/4 of them will become carriers and will continue to shed the virus. Keeping your calving pens clean is essential to preventing the bacteria from spreading through your herd. Even if you remove the bedding, the bacteria will remain present in the biofilm. Here are some tips to prevent Salmonella Dublin. Clean out your pen with water. Use a low-pressure foam cleaning with a disinfectant. Concentration and contact time are essential when killing a pathogen. Use a chlorine dioxide-based disinfectant. Put transition cows on a probiotic so that they're less likely to be infected. Consider putting drains in your calving pens so that they can be cleaned properly. Do a sanitation audit and water analysis. Use your own equipment to transport your animals because commercial trailers can have Salmonella. One study done showed how easily Salmonella Dublin can be transmitted through bedding. Fresh bedding was placed on top of contaminated bedding and then walked on with booties. Only 3 hours later, the salmonella was found in the fresh bedding. Within 24 hours, there was enough salmonella in the bedding to make the calf in that pen sick. If you have Salmonella Dublin in your herd, here are some steps on how you should manage your calves. Remove the calf immediately and place in a pen that has been disinfected and has fresh bedding. Feed the calf pasteurized colostrum. Place on probiotics that have a good activity against Salmonella Dublin. Monitor the calf. Most importantly, don't let anyone go into the pen. Boots can be contaminated, and if you need to go into the pen, make sure that your boots are sanitized first. Salmonella Dublin is very difficult to eradicate, but you can control it with the right management strategies. It is an orally spread bacteria, which means that calves can become infected by licking or ingesting anything in the environment that is contaminated. Minimizing stress can help prevent the spread of it as well.